One, in terms of clinical outcomes, is a project that we implemented to use the Columbia Suicide Severity Rating Scale, or the CSSRS, in our public school counseling program. So we trained about 85 counselors who are co-located in a public school to use this instrument that stratifies risk for kids that are expressing suicidal ideation or exhibiting suicidal behavior. By training these folks, we were able to hit about 1,300 kids.
Our average return rate for the standardized annual survey is about 6%. In our most recent test of the paper surveys, of the 400 clients seen across our office sites, we received an average return rate of 45.6%, with one office reaching a return rate of 67% of the clients seen. It is clear that the personal approach of asking clients to consider filling out a survey as a rate for their next appointment is a better method. With a high feedback rate, our clinicians are receiving immediate feedback on the quality of care they provide and are able to make adjustments accordingly.
Up here in Washington County, our patients don't have the outpatient services that they do in urban areas, and anything that we can add to that, such as the chronic care management, I think would help the patient's health status as well as reduce readmissions to the hospital.
So we started out with roughly around 6 patients, asking them how they're doing, going over medications, making sure that they were okay and if they needed anything. And now we are up to 96 patients that I call weekly.
It has reduced my potential for crises management.